most popular innovations this last couple of years that we have seen have been in generative AI, of course. But innovation has continued in so many areas like robotics, which is a very promising area where artificial intelligence is washing over any wave of innovation. That is why I am excited to introduce Jordi Albo. Jordi is deeply passionate about improving people's quality of life through technology and how this technology can be transferred from academic applied research into industrial products. Jordi, I know you have been involved in robotics projects, including in hospital environments with children. Can you help us understand where we are and where robotics is going?
Oh, yes. It's first of all, thank you very much for inviting me to participate to this huge event, and big congratulations to the organization, because it's like I was listening to the previous speaker. I say, okay, it's like we cannot be better coordinated. I think that it's like we are in that point that because of the benefits of technology like generative AI, this technology become more social or more human, and that it's being seamless, and that it's helping a lot to be adopted. So I think that we are in a very, 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 very interesting time. And if we succeed to put regulation and adoption at the same level of the technology, we will see a huge improvement of quality of life. Yeah, should I proceed with my presentation?
Yes, please. Thank you.
Okay, cool. Okay. So, the idea that I have today and for this seminar, it's to first establish the basis about the generative AI and robotics that we can see today based on the state of the art. And after that, I would like to showcase 4 cases where we are using that technology and with tangible assets that hospitals are already taking benefit of it. Just to give a little introduction, it's like we try to create tangible assets based on applied research and using cutting-edge technology that creates business opportunity, taking benefit of like the best innovation ecosystems worldwide. So we are mainly operating in all continents. We have people distributed in 4 different continents, and so it's like we say that we work 24/7. And we cover like all the different areas that using like the artificial intelligence and robotics. But what we believe that it's very important, it's understand the level of readiness and to be sure that we are doing responsible AI solutions. Without spending more time with that part, I would like to give you like first an overview about the basis, and from the basis showcase the use cases. So if we take a look, we have artificial intelligence that is a simulation of the human intelligence, but adapted to the machines. Those machines, they need to learn, and the technique to learn, it's the machine learning. Recently, I mean like several decades ago, they start to use like a simulation of the neural networks, and that provide deep learning. And recently, we have seen the appearance of like the generative AI, where the advantage it's like the AI systems start to provide information and generate information, and that's the big difference. If we look to the core is the data, and we need to have data that is healthy and valuable data, and that's the reason because a lot of the companies that says that the data is the oil of the 21st century, and we only have to see the companies that making big money right now, and even considering that some of the oil companies of the past, they are investing on data right now. AI and machine learning could be the electricity, and generative AI have to be conceived of the internet as a kind of like the disruptive of this technology. A lot of the cases that we will see today about using robotics and AI in health, they are using a concept called personalized machine learning, that we are focusing a lot, not with data from several patients, but with data of one single patient among period of time. And that helps to improve privacy. But we also talk about robots. And I would like to make a clear point about the type of robots that we are talking about. First, I understand that robots are the interface between the digital world and the real world. I can have like a keyboard, a screen, or a pad in order to interact with the technology. So I like to say that the robots are the embodiment of the artificial intelligence, and that it's so important how they are designed. And robots with the new technology and the new artificial intelligence like the generative AI, they have a better social presence. And the perception of the user, it's like makes things easy to adopt. So it's very critical to design all these things in order to improve human perceptions. During my period of time in the Netherlands, I learned a lot about working with Marcel Herring about how important is perception, even versus performance. And right now, one of the benefits and also one of the challenging things of generative AI, it's like the perception, it's even sometimes much higher than the performance of the system. That looks really great. And then it's like we use a lot, and also based on my previous experience at MIT Media Lab, we use a lot about this combination about human attributes and machine attributes. So we use social robots that are socials that are based on social behavior, based on human and animal rules, and we use affective computing, that is how we use computing power in order to understand emotions. On the left side, you can see some of the examples of different activities using robots. So it's like improving therapy, calming kids in chemo at the Barcelona Children's Hospital, or like even interacting to increase engagement. So where we can apply all those technologies. And all those technologies we can apply in different fields. You will see in the different cases as an examples, but it's like you can enhance the analytics, you can use it for forecasting. You will see how we try to forecast falls, that it's very important and relevant in the health sector. We want to understand what is going on using sentimental analysis. You will see that in the palliative care project. We can automate and enhance productivity, and in that case, it's, as the previous speaker said, improving quality of life of medical doctors and nurses in order to provide a better service. At the end, we optimize all the process, and this technology today, they can copilot and they can empower the people to make a better jobs, having these extra artificial agents, and everything that it's happening is driven by data. So it helps a lot to give like decisions and understand and how to proceed in order to enhance the efficiency of the resources that we have. However, we need to be careful because there's a set of challenges that they have already identified for the community, but I would like to remind all of them, and not only about what it's easy to think about, that it's the regulation and IP issues and things like that, but those systems are trained with samples that can bring bias, and also the types of use that I'm doing can be very controversial. So ethics are very important because regulation talks about white and black areas, but we have gray areas using AI and robotics technology. And in these places where ethics can help a lot to manage that. And then it's not forgetting that we have these systems that they are super powerful, but super powerful means that they also put a compromise into the efficiency and sustainability in terms of environment, because it's like somewhere we'll have like a bunch of servers that are consuming a lot of power and generating a lot of heat. Going back to the application, and a way to understand the role of AI and robotics and humans in the health sector, but also in the other sector, it's like I have in one side humans. Some of the humans, they use AI technology, the same way that we are prompting on ChatGPT or other large language models. In some other cases, I have technology that are monitoring me, and I don't see that technology. So it's like the AI system is controlling me. In the intersection of these two worlds, it's like when I have what I call augmented humans. and the way that AI technology, generative AI, and robotics can be implemented in different domains. And what we are talking about today, that it's the health sector, it's in order to augment human capabilities. The patient, but also the nurses and the doctors, as has been said before. The way to do that, it's a way that we want to be as seamless as possible. I like very much what Simon said, that it's like we need to have this technology being integrated without interfering in the regular life of the doctor. And I like very much one approach that it's called the perceptual control theory. And I will overview this diagram pretty fast, but the idea is like one agent is interacting with another agent. As an agent and as an artificial agent, I perceive the environment, I use my AI system, I train it, I learn, I take decisions, and then I try to create a stimulus in the real world. So all the examples that you will see, we have a behavior of someone that could be a medical staff or a patient, and that behavior can be optimized. How this behavior is optimized, it's based on an AI and robotic system that performs any action, trying to drive that behavior, and that is what it's called perceptual control theory. All the AI system, it relies on engagement, it relies on understanding patient and medical total perception, and estimating what is next, and forecasting what is next, and trying to, what is very important, that it's prevent and not correcting. So I think it's like if we can address prevention instead of fixing or correcting, we're improving a lot what is going on. So let me showcase 4 of the use cases that that we have been developing at Lighthouse using generative AI and robotics. The first one, it was developing one of the technologies of a startup from MIT and led by Luis Soxen, where it's like they were using narrative medicine. So one of the issues that the challenges that they had, it's like the medical doctor, the doctors are very difficult to understand what was going on with the patient with a simple visit, and they need a lot of time to process that information, and it's time that they don't have. So what if I have a system that is aggregating all that information and processing and highlighting what is going on, creating the story of the patient? And then it's like as soon as the doctor is meeting the patient, that they understand what that was coming from. So it's like through a conversational agent, through a video conference, through a phone call. I'm interacting with different people. Those people using the TOCI system, it's collecting that information and highlighting that. And the idea is to save time and help better understand what was going on through a dashboard to the doctor. Another project in collaboration with the Brigham and Women's Hospital and Harvard Medical School, and with the project lead by medical doctor Samir Tulaber. Very interesting that all the professionals that I'm including in this presentation, as also it was said before, they are medical doctors, they are nurses, they are people in the field where we are applying this robotics and AI technology. So this is a very interesting project. The interesting project is about reducing falls. And just to give you some numbers, falls in the US, they cost about $34 billion. We recently talked to a hospital in Barcelona, and they were having exactly the same issue. And how you can avoid falls? So after a study in Barcelona, they came with in Boston, they came with the idea of implementing the early rounds. So nurses, every hour they visit the patient and they check how the patient is doing. What is happening is the nurses spend more than 30% of the time filling in the system and doing a lot of administrative stuff. And there's a shortage and there's an overload. So it's very difficult. So at the end of the day, it's difficult that they can take care of the patient and in order to understand what is happening. At the same time, the resources that they have right now, like the emergency call button, is difficult to find. Sometimes it's difficult to press. So we have been working on a conversational system embedded in a teddy bear, the stuffed animal that the patient can hold, and the patient is using a conversational system right now also based on large language models, talking to the patient, extracting the position, the pain, the personal needs, and the body issues that the patient can have, and try to predict if the patient is going to stand up or not, and then communicating to the nurse and sending a text message to the nurse. The way that we design the system is to be as seamless as possible, and the way that the nurses interact are the same way that they are interacting with the other devices that they have inside the room. With the Barcelona Children's Hospital, we have been working in a system in order to monitor families that they have children in palliative care at home. And one of the ideas that we have here is automate the collecting data process and optimizing the system by minimizing the errors collected that information. So using the last technology and AI, we can try to predict readmissions to the hospitals at least with 24 hours. So we can prepare that the beds are ready and the survival rate of those kids in very critical condition can be increased. Because of these new technologies like large language models and so on, it's like the results that we are obtaining in terms of adoption and acceptance by the families is like much higher. And here we have been using one of the technologies that it's called WeShareCare, that is using AI systems that in order to understand, okay, it's like, what is the value of the different machines that I have at home? I can take pictures, and the AI system, it's reading the pictures and translating into the text, explaining what was the reading of that value of the picture. And also processing the information of exchange of files between medical doctors and families, and trying to guide through the processes about how to do different treatments at home with the families. And last but not least, one of the very successful projects that we have in collaboration with MIT, Hyundai Motors, and the Barcelona Children's Hospital, it was a robot car including almost all technologies possible that was estimating the level of stress of kids before going into surgery, with the main objective to reduce their stress and also avoid pre-medication by keeping them distracted with an AI-powered car that has since an haptic stick that was moving, a screen, music, an essence that was allowing them to smell the same substance that inside of the operating room. It is a study that it just published, and I'm going to present the paper in a couple of weeks in Colorado about how to deploy this robotic car in a real environment. So the video about the project got like 15 million views during the first month on YouTube. And that was using all that technology also to understand that face emotion and the skin conductivity and everything. So it was a kind of big fusion of all this artificial intelligence in order to understand what was going on with the kid in the 10 minutes prior to go to the surgery in the waiting room. And with these examples, I would like to finish my conversation and spend the rest of the time that we have in order to answer different questions. Thank you very much.
Yes.
Thank you, Jordi. That was so enlightening. It's really fascinating how we can create a more human environment in hospitals with robots, right? Which sometimes looks like a contradiction, right? And from that perspective, I have a question for you that has to do with how robots interact with people in security and privacy, right? So you have spoken about robots in the hospital environment, including interacting with children, right? So that begs the question about privacy and the liability of the hospitals or the robots on the interaction with humans. So what are some of the ways in which we can guide and oversee AI and robots so this interaction protects privacy and is safe?
Yeah. One of the things that we are doing with all the projects is trying to follow like the GDPR and HIPAA compliance of all the systems in order to protect the information. In our conversational systems that we have implemented, like the one with Brigade, led by the Dr. Samir Tulabeb, It's like the system, it's not listening all the time. It only listens when the timer trigger, it's time for the early round, and the system it's letting you know, okay, it's the early hour time, and now I will start to listen to you and asking questions and showing everything, and then collecting that information locally, and then securing that information using, in some cases, edge computing in order to allow to limit the exposure of the technology, regardless of having all the levels of protection. And then we develop a compliance framework. I have been working a lot in about people's perception of what is right or not, and part of the pictures that are behind, and one of the references was about a free book that you can download, mainly written by Cesar Hidalgo, that I collaborate about how humans judge machines. And we use that technology when we implement the systems to be sure that people feel secure when they are interacting with that technology.
I was reading recently about the concept of liability when AI models are making recommendations to customers or patients in this case, right? So in these cases, clearly the robot is interacting with patients in a hospital setting. But from a liability perspective, if something goes wrong with that robot, if it provides a comment that is out of place or makes a recommendation that was not a good idea, who is liable for that? Would be that the hospital, would be, is the robot an entity, would be whoever built the robot? And do you have any experience around that?
Yeah, well, as you can imagine, it's like implementing technology like this in the wild. We have a lot of experience with that. It's like sometimes the robot runs out of batteries, and then just remember that the car was trying to bring the kids without pre-medication in the surgery room. It means that the car was not working, and then a kid was getting into surgery without pre-medication. and who was blamed for that? I can tell you it was me mainly. So it's like that is in case of the liability. That is a very good question. It's like, there's different regulations. It's like you have a device, the device has to be certified. Once the device is certified, it has like an insurance implement connected to the device. One of the limitations, it's like if it can be prescribed, if not, it can be used. If not, in some cases, we are in the early stage. But I would say that it's like mainly liabilities, still having the human factors. And the reason it's because the robot is giving a recommendation, like the teddy bear, but the final call it's made by, in that case, by the nurse who is receiving the information. So we are trying to augment the nurse work. We are trying to augment the doctor's work. We are trying to increase the quality of life of the patient, augmented the caregivers, the parents' work. But the work is mainly done by humans at the end, and the liabilities. One of the outcomes that we got from the book that I mentioned before, it's like, it's very interesting that it's like when you use technology like this, you also shift responsibilities from a perception point of view. So it's like, it's more likely that it's like, if you have like, if you have like a surgery and it's done by a surgeon and something goes wrong, people are going to blame the surgeon. But if the surgeon is using a technology and it goes wrong, then it's shifted, not to the surgeon, but maybe to the institution. And all these things, they need to be addressed to. And it's a lot of, it needs a lot of unknowns. It's like, because it's like, and that's about how people perceive. And that's why I was talking about perception. But right now, as I said, it's like what makes sense is to augment human capabilities. And because you're augmenting a capability of a human using that technology, it's like using generative AI to create a report or anything. It's still remaining on the human side, the liability.
Wrap it up, please.
I think that kind of makes a lot of sense. So I'm going to give back the conversation to our studio in Rotterdam. So Robert, Marcus, Edward, take it from here.
Jordi, I do have a question for you. Who's going to pay for all this? Because these investments are to be made are quite significant. Who will pay who's willing to pay, or who's paying the use of robots in healthcare?
The project development, right?
Yeah. So the initial investment, but also the use of it.
Yeah, well, it's like it depends about the project, but because it's like the ones that I mentioned, it's like the falls. It's a clear return of investment of the hospital. So one single hospital can have about $1 million lost because of the falls that could be avoided, and that loss goes to the hospital. So just paying for the system will reduce that money that it's going away because of the falls. In some other projects like the WeShareCare, that's like it's a prescription model. It can be paid by the insurance because it's a way to secure that it's less readmissions to the hospital, so that at the end it's like they are saving money by not having to compensate to the patient. And in that case, it's more likely coming from the insurance, but also can come from even the end users that they want to avoid having that issue. It can also shift. We have seen different approaches compare Europe to the US system. So the dynamics about the health system, when you have a private one, and regardless of having an insurance and everything, and I can tell you by experience living in Boston, you can imagine that it's like all of we have to face like this like bill system. You as a user, you want to invest as much as possible to try to avoid, regardless of the insurance of everything that happened. In Europe, it's completely different. That is, you have a public system, and then you expect everything to be covered by the system. And then who is going to pay for that? It's more like the system and less the user. So there's these two approaches. But I would like to say the hospitals, in order to save money, and also the users and the insurance companies in some cases.
So one philosophical question. Can I, as a patient, choose in the near future whether I want to be operated by a robot or by a human person?
Well, that final call should be done by the patient. And that's a very philosophical question. And I strongly suggest to read the book, not selling the book because it's for free, but honestly, because it's very interesting that it's like people, the judgment, it's not based on the optimization, and it's like autonomous cars. That is like, if I have to say something, I would always prefer the robot in terms of the surgery, because it can predict a lot of like movement of different organs on unexpected things. But the final call, you want to be made by humans right now. And yeah, but it should be done by the patient at the end of the day, because it's your life.
It's my life. And at the end of the day, we also, as a patient, pay for it, one way or the other.
Exactly. One way or the other, exactly.
Yeah. Thank you for your keynote.